Hello everyone, let's test your knowledge on the unit Schizophrenia from Clinical Psychology. Welcome to the Psychology Revision Quiz series with Sir MJ. Complete the following sentences by filling in the blanks. Read carefully and recall quickly. Are you ready? Let's begin. Schizophrenia is a severe psychotic disorder that leads to blank, where individuals perceive the world differently from others. This may involve distorted thoughts, emotions, and behaviors. And the answer is psychosis. Let's move on. According to the ICD-11, a diagnosis of schizophrenia requires symptoms to be present for at least blank months and must not be attributed to other health conditions or substances. And the answer is 1. Keep it going. A core symptom of schizophrenia is blank, where the individual has firmly held beliefs that are not based on reality, such as the belief that others are trying to harm them. And the answer is delusions. Let's keep moving. Blank is another core symptom where an individual experiences sensory perceptions, like hearing voices or seeing things that others do not. And the answer is hallucinations. Next one. An individual with schizophrenia may also suffer from a blank disorder, where their thoughts and speech become disorganized, making it hard for them to communicate effectively. And the answer is thought. Let's continue. A person with schizophrenia might feel that their thoughts or actions are controlled by an external force, a symptom known as blank. And the answer is passivity. On to the next one. The term blank is used to describe a lack of motivation or goal-directed behavior, which is common in individuals with schizophrenia. And the answer is avolition. Moving forward, blank refers to a reduced emotional expression, where an individual might display fewer facial expressions or show a lack of emotional response to situations. And the answer is flattened affect. Let's go! Cognitive symptoms of schizophrenia can include blank, which refers to difficulties with memory, attention, and problem solving. And the answer is impaired cognitive function. Next up, a person with schizophrenia might experience blank, which is characterized by a lack of movement or speech, often leading to social withdrawal. And the answer is catatonia. Let's keep going. Symptoms of schizophrenia are categorized into blank and blank types. The first refers to experiences that are added to normal functioning, while the second refers to a decrease in normal functioning. And the answers are positive and negative. Moving on. A blank symptom of schizophrenia involves a distorted perception of reality, such as hearing voices that others do not hear or believing in unreal things. And the answer is positive. Next one. A blank symptom, like avolition, involves a decrease in motivation and energy, which makes it difficult for individuals to initiate or complete tasks. And the answer is negative. Let's keep it up. Blank delusions involve beliefs that others are intentionally trying to harm or conspire against an individual. And the answer is persecutory. Keep going. Blank delusions refer to the belief that an individual has special abilities, often including a sense of superiority or grandiosity. And the answer is grandiose. Let's move forward. Blank delusions occur when an individual believes that events or objects in the environment have a special significance for them, such as thinking a television program is related to their life. And the answer is delusion of reference. Let's move on. Blank hallucinations are the most common form of hallucination in schizophrenia, where an individual hears voices or sounds that others do not hear. And the answer is auditory. Great job! Next one. Blank is the term used when individuals believe that their thoughts or actions are being controlled by an external source or force. And the answer is influence. Let's keep going. Blank ideation is the term for the persistent belief that others are plotting against you or trying to cause you harm, even when there is no evidence for this belief. And the answer is persecutory. Next up, in the case study by blank 2018, a young boy diagnosed with early onset schizophrenia started hearing voices at the age of 12 and exhibited erratic behavior. And the answer is aneha. Let's move on. The study conducted by blank et al. 2003 investigated how virtual reality VR could be used to explore persecutory ideation in people without a history of mental illness. And the answer is Freeman. Keep going. The sample for Freeman et al. 2003 study consisted of blank participants, which included male and female students and staff from University College London. And the answer is 24. Let's go. Participants in Freeman et al. 2003 interacted with blank avatars in a virtual library environment, which helped the researchers explore the role of persecutory ideation. And the answer is 5. Next one. The psychometric measure used in Freeman et al. 2003 study to assess participants' paranoia was the blank questionnaire, which examined levels of interpersonal sensitivity and paranoia. And the answer is Brief Symptom Inventory BSI. Let's move on. In Freeman et al. 2003, a significant correlation was found between scores on the blank questionnaire and interview-based measures of paranoia. And the answer is paranoia. Keep it going. One of the findings from Freeman et al. 2003 indicated that participants who had higher levels of blank were more likely to experience persecutory ideation in virtual reality. And the answer is interpersonal sensitivity. Next, the blank scale was used to assess participants' baseline mental health and anxiety levels before they entered the virtual reality environment in Freeman et al. 2003 study. And the answer is Brief Symptom Inventory BSI. Let's continue. In Freeman et al. 2003, the avatars used in the virtual reality experience displayed blank responses, meaning they had neutral body language and facial expressions to avoid triggering any overt hostility. And the answer is neutral. Moving on. The study by Freeman et al. 2003 concluded that people experiencing high levels of blank sensitivity are more likely to experience persecutory ideation in virtual environments. And the answer is interpersonal sensitivity. Final one. Freeman et al. 2003 suggested that virtual reality could serve as a valuable tool for studying blank ideation in a controlled and safe environment, providing insights into mental health conditions like schizophrenia. And the answer is persecutory. Well done, you've completed the quiz. This quiz is intended solely to support students with their learning and revision. Please note that in CAIE exams, questions are not presented in the form of fill in the blanks. This format has been used here only as a revision tool to help you recall key concepts. To prepare effectively, you are strongly advised to read through past paper questions and understand the structure and style of actual CAIE exam questions. I hope this was helpful. Thank you.